Okay, we might kick off, I think, folks. So welcome, everyone. Thank you for joining us here today for today's webinar on health complaints in the ACT and the launch of our two new consumer resources, which are a guide to healthcare complaints and a guide to mental health complaints. My name is Kate Gorman. I'm the Deputy Director here at the Healthcare Consumers Association. And this webinar is number 3 of our health literacy webinar series for 2022. I'd like to acknowledge that we're hosting today on the beautiful lands of the Ngunnawal people here in Canberra. I pay my respects to elders past, present and emerging and thank them for their care of our country and their contribution to the life of our city and our region. I also pay my respects to the traditional custodians of the lands from which all our presenters and participants might be joining us today. So a little bit of housekeeping as we get going. Today's webinar is being recorded for the Canberra Health Literacy webinar website. That's a website where it will have its permanent home, and also YouTube. There's a bit of information in the chat if you'd like to change the way you're viewing the webinar today. We've only got an hour, so unfortunately we don't have time for lots and lots of questions. I know there will be quite a few though. The questions to our panel members today have been crafted by us from what consumers, the concerns that people have raised with us over time, and also things that our participants today have let us know about in the registration process. If you do have more questions for us though, you're very welcome to drop them into our chat as we go along. And we'll do our best to get to them, noting that we can't provide detailed, specific advice on individual situations today. But for any unanswered questions we do come across, I will commit to finding some guidance for you and circulating that in an email to de-identified to all the participants after the webinar today. So I also want to acknowledge as we kick off that some audience members might be here today because they've had a difficult or an unsatisfactory experience with healthcare, and they might be feeling a bit upset or frustrated about the things that have happened. And I do absolutely acknowledge that reality. However, I would like to ask you to please keep your comments and chat constructive and respectful. And I also invite you to get in touch with HCCA after the event today if you'd like to discuss any of the content from today. So to kick things off, I'd like to introduce you to Sarah Spiller, who's HCCA's Manager of Research. These guides are the result of a project that she has lovingly looked after, and she's here to tell you all about them. So welcome, Sarah.
Thanks, Kate, and thanks everyone for joining us. I will only speak really briefly. I think like everybody, I'm really keen to hear from our panel, but I thought I would just take a couple of minutes to talk to you about why HCCA has developed these resources and how we've done it, and to show you part of one of the resources, just to give you a sense of what they are and what they look like. So HCCA has heard for many years from people about how difficult complaints processes can be. It can be really hard to know what you can do to raise a concern when something goes wrong in your care or the care of a family member or a friend. Many of us don't know how we could do that, how we could go about making a complaint, or what difference it might make. And there are lots of reasons why people hesitate or think twice before starting a complaints process. And we heard those concerns about complaints really clearly back in 2020 as part of a series of conversations that we had at that time with around about 80, 85 community and consumer groups and health services about health literacy strengths and opportunities and gaps and opportunities to support health literacy in the ACT. So those conversations were part of an ACT Health Directorate funded project called the Canberra Health Literacy Project. The Community Health Literacy Project, excuse me, and we do need to thank the Health Directorate for making it possible for us to develop these complaints guides as part of that project. So we started work on a guide to health complaints back in 2020. A lot has happened since that time, and over that time the guides looked quite different in draft form. It's benefited hugely from the advice and time that a lot of people have offered to comment and advise us on the process. And of course, any problems with the guides are HCCA's responsibility, but there are a lot of people to thank. So that includes a number of HCCA members, among them Fiona Tito Wheatland, Joanne Baumgartner, Chris Bowman, Pam Grodens, who commented on an early version of the guide. And we also owe thanks to the consumer, carer and health advocacy organisations who have been part of the process of developing the resources. So I hope that you see your comments reflected in the resources. In particular, we need to thank Advocacy for Inclusion, People with Disabilities, Carers ACT, the ACT Mental Health Carers Voice, Canberra Mental Health Forum and the Mental Health Consumer Network for your guidance along the way. And I particularly want to acknowledge the time and contribution of the members of the Mental Health Complaints Advisory Group who've given a lot of time to advise us on the Mental Health Complaints Guide last year and into this year. So thank you to Bianca Rossetti, who is here as part of our panel today. Bianca was a member of that advisory group for the Mental Health Community Coalition's Lived Experience Advisory Group and the Mental Health Consumer Network. Thank you to Jen Nixon from the Mental Health Consumer Network, to Catherine Von Arx from Carers ACT and ACT Mental Health Carers Voice, and thank you to HCCA members Ajaz Sana, Priyanka Rai and Karen McKernan. I would also like to thank the staff in the Office of the ACT Health Services Commissioner who gave their time really generously to comment and advise on drafts along the way. And also to thank Dr. Elizabeth Moore, Coordinator General of the ACT Office for Mental Health and Wellbeing, and staff in her office for their advice and support of the project too. Finally, and this is the final thanks also to the members of HCCA's Health Literacy Advisory Group who have overseen this project from start to finish, and I know there are some of you here today. So many of the people who've advised on the guides over time have done so because they've had difficult experiences of complaints processes. These guides to our complaint system don't change our complaint system, but we do hope that they make it easier for people to know what your options are if something goes wrong in your care. And we hope that they make it easier for you to know what you can expect, where to go for support if you need it. So the guides are a series of short fact sheets of 1 to 2 pages. The idea is that each of the fact sheets should stand alone and you should read those fact sheets that are most relevant to you. We'd encourage you to start with the first fact sheet in each of the guides, so the Guide to Complaints and the Guide to Mental Health Complaints, because that first fact sheet tells you, your key options, whatever has happened in your care. So if the technology is with me, I will share the first fact sheet in the Mental Health Complaints Guide, just to show you what that looks like. So this first fact sheet, and the content in the first fact sheet for the Guide to Health Complaints looks pretty similar, and the content is pretty similar also. But what it covers off on are your rights to make a complaint or give feedback and your options in any circumstance. So essentially those are to talk to the people who are providing your care if you feel comfortable to talk about the problem with them, to talk to the person in charge and see if they're willing to help you find a solution, to use the complaints and feedback process of the service. Every health service will have one, or to contact the ACT Health Services Commissioner who will work with AHPRA if that's appropriate. And you can contact the Commissioner's office for advice at whatever point you're in the process. The fact sheet also includes information about where you can go for support and some tips about preparing for a complaints process. The other fact sheets in the resources cover topics like how to make a complaint about a health professional and how to make a complaint about a mental health professional. And there's more information in those fact sheets about AHPRA's role, advice for carers, friends and family members, what to expect in response to a complaint, why make a complaint and what you could expect from the process, and how to request access or a change to your medical record. The guides also include a directory that has information about organisations that can help you through the complaints process and the details for the complaints and feedback processes at all ACT hospitals and a number of larger ACT health services. There's also information in that directory about additional options that you may have in some specific situations. For example, if you're contemplating making a complaint about a private health insurance matter, problem with Medicare, healthcare you received in another state or territory, the NDIS, or healthcare provided in residential aged care facilities. So in a nutshell, that is the guides. You can contact HCCA if you would like hard copies, and you can also download them from the HCCA website, and I saw there's a link in the chat. We welcome your thoughts and your feedback and very much hope that you find them useful resources. Thank you.
Thank you, Sarah. That was a great introduction. And gee, what a lot of people helped us through that long labour and delivery of these guides. I think, you know, there's a lot to be proud of there, and I hope that people do find something there that can help them. So that really brings us to the panel part of today. I'd now like to introduce our panel guests to you. First of all, we've got Karen Toohey, who's the ACT Health Services Commission. Hello, Karen. Since 1995, Karen's worked in senior executive roles in state and Commonwealth human rights agencies, including time in Victoria as the CEO of the Victorian Equal Opportunity and Human Rights Commission, and as Assistant Commissioner at the Office of the Australian Information Commission. So Karen has been our ACT Discrimination, Health Services and Disability and Community Services Commissioner. Gee, what a mouthful that is, since 2016, and she's a well-known advocate on issues of human rights and discrimination law. Joining her on our panel is Bianca Rossetti, previously just mentioned. Bianca's a passionate mental health advocate who believes in systemic reform to ensure that people's needs in the community are met. And as Sarah said, she joined us in the creation of these guides. Bianca identifies as a person living with mental health issues and understands how facing that alone can be challenging and difficult. She's become a member of advocacy organisations which help her to use her perspective to work for systemic change, which helps the community. And she's involved in a number. I've got 5 different acronyms here, Bianca, of all the different consumer and mental health advocacy organisations in the ACT that you belong to. And she also appreciates the organisation Carers ACT as she's a carer for her son. And Bianca, in addition to all of that, she's completed a number of qualifications that give her skills and knowledge in mental health, teaching, nursing, peer working, to name a few. So welcome, Bianca. And finally, we've got Anthony McCachran, who's the Territory Manager of AHPRA for the Australian Capital Territory. Anthony was motivated by the Australian Health Practitioner Regulation Agencies, or AHPRA's, commitment to ensuring safer healthcare, and he joined it in 2011. And he's had a range of different positions there, leading to his current one as the Territory Manager in the ACT since 2016. He's interested in culturally safe practices for Aboriginal and Torres Strait Islander peoples and increasing the diversity of voices that inform the work that AHPRA does. So welcome, Anthony. I'm going to kick this discussion off with a question for Bianca. Bianca, why is it important for consumers to have this guidance on how to make a complaint?
I think just through a lot of the feedback that, you know, Sarah spoke about, you know, collecting that data, it's really important for consumers to have that sense of accountability, transparency, but also to feel validated with their perspectives, with their experience. So, you know, if they have a concern, someone is listening to them and they have that correct procedure to know how that process is to be listened to. And then hopefully that also then leads on to improvements in the service.
Thanks, Bianca, because it can be quite complicated to know what to do and who to take it to and how those systems work when you've never perhaps done that before, or you don't know where to start with it all. Now, Sarah mentioned that, you know, the first things you might do are talk to some of the staff of the health service involved. But we've also, you know, there are other options, and we've got Anthony and Karen here to tell us a bit more about those. So I'd like to ask, well, either Anthony or Karen, one of you can go first. Beyond the health service itself, what is the role of, well, let's go with you, Anthony. What is the role of AHPRA in the complaints process?
Thanks, Kate. I'm happy to go first. I'll see if I can do that justice. So look, AHPRA is part of a wider ecosystem within the healthcare system. We look at complaints, or what we call notifications, that relate to individual practitioners. What we don't do is look at things that might be systemic, so looking at things that might happen in a healthcare setting. So that puts some parameters on the sorts of conversations and dialogue that we can have. But thinking about what we do outside of our own work, there are other little levers that we have that can help influence better outcomes for people receiving health services. So it's things like where we try and assist the boards to have clear continuing professional development standards. Things like that, we can take action when practitioners breach or fail to adhere to their continuing professional development requirements. So one of the things that we've been doing is advocating to have things like cultural safety training embedded in continuing professional development standards to help improve health outcomes for Indigenous Australians. So that's kind of one example of the things that we try to do outside of that core investigation of complaints or notifications against individuals, and use that information to inform policy decisions that might be effective nationally.
In a sense, it is about individual practitioners, but that knowledge informs what you might require of practitioners more broadly.
Yeah, that's right. And because we're a national agency, we get to see these things play out across the country. So we get to see what different factors that might be, or we might see commonalities and themes, or we might see jurisdictional nuance that might help inform best practice or research pieces for the agency. So that's sort of one of the ways that AHPRA can work differently, because it does do specific jurisdictional work, but then sits in a broader national scheme as well. So quite unique and quite well placed to have a think about the things that it can do.
Right. Thank you, Anthony. Karen, would you like to complement that with a bit of information about the role of the Human Rights Commission?
Thanks, Kate. Yeah, so our role is a little bit different in that we work with AHPRA around those matters to do with individual registered health practitioners in the ACT. So that's doctors, dentists, pharmacists. And we have a collaborative model or a co-regulatory model with AHPRA in that space. But alongside that, we have a broader health service complaint jurisdiction. So that covers any health service that's provided in the ACT. So that is, yes, the hospitals, but it's private practice, it's individual practitioners, it's allied health. So it's a whole range of things, including those other settings that you just mentioned, like aged care, like disability, where there's a health service being provided there. So while we're, responsible for investigating and usually trying to conciliate those complaints, we also have that broader responsibility looking at systemic issues. So we can deal with an individual matter, but if it raises systemic concerns about how a health service is being provided in the ACT, we can both deal with that through the individual matter and make some recommendations in that space, or we have these broader inquiry powers that allow us to branch out and do what's called a commission-initiated complaint. And that means that it might be a longer and more detailed process, but often leading to broader recommendations to the providers or to ACT Health or to the ACT government, in fact, looking at systemic responses to those issues rather than just dealing with the individual issues raised by the individual complaint.
Thank you, Karen. So I'll go back to you, Bianca, now. What advice, going back to thinking about somebody who might have had something happen and thinking about making a complaint about it, or, providing some feedback. What advice would you give to somebody in that position?
I think, having health literacy is really important. Understanding what the purpose is of the complaint, but also understanding that the word complaint, it kind of I don't like the word complaint, and I think I did mention this when we put it together, because I think as a consumer, you need to understand that it's more critical feedback than a complaint. So, what is the purpose of going forward? If we're going to follow these fact sheets, it needs to have that outcome. And that's what I was saying, at the beginning. It's that accountability and transparency that if, as a consumer, we're going to raise an issue or concern, that it's going to be followed up. So instead of just saying, I'm going to complain and whine and whinge about something, I want actually that critical feedback of accepting and understanding that this is the issue and what are the next steps? So where are we going to go with this to improve the service for myself as a consumer, but also systemically, what can we do to help others that are going to use the hospital or, that service that, we've been talking about.
Yeah, that's a good point, Bianca. Often we're motivated, I think, as consumers to say something because we want to improve it for the people that come after us. What's happened has happened for us, but and there may be resolution that we can get, but we want to kind of try and make sure that these things don't happen again.
Yeah, and sorry, just to add to that as well, I think it's really important to recognize that you don't have to do this alone. And in those fact sheets, we have that information that if you, identified your purpose, identified, what, you want as a result from, this feedback, I'm not going to say complaint, feedback, have the advocate, have the support person, have the organisation. So, go to HCCA website, get these fact sheets, contact the people that are on these sheets. Don't think and assume that you have to complain on your own, because it's a very overwhelming process to do it alone. So involve those agencies that are out there.
So get some support in whatever formal or formal way that can happen. Absolutely. Karen, have you got some good advice for people who might be thinking about raising a complaint? And I know we've got that complaint feedback. We had that discussion many times over the course of this, the creation of these guides.
Yeah, look, and I appreciate, Kate, as you said right at the beginning, for some people it's a really overwhelming thing to think about bringing a complaint. But I guess we encourage people to pick up the phone, give us a call to get some information about their options and about what that process looks like. It doesn't always need to be saving the world. Sometimes the matters that we deal with are actually short and sharp and we can get them sorted out fairly quickly. Some of them where it's far more complex or there's been an adverse outcome, they are more difficult, and we just acknowledge that to people that we try and set people's expectations around how simple something might be, but also how complex it might be depending on the nature of the concerns. I think the other thing that we just encourage people to do is not self-select out, so not assume it's going to be so hard that it won't be worth the effort. And certainly the guys in my team who provide a friendly voice on the other end of the phone are here to work with people in the complaint process. So we're not advocates. We can refer people out to those services, and we certainly have advocates involved in the process. But I think, as Bianca indicated, one of the motivations for people often is to try and improve the service for the next person who comes along and accesses it. And I think sometimes that can be something that is a real energy for people to bring into the process. And I think the other thing in a small jurisdiction I would suggest to people is sometimes people are worried about bringing a matter because, it's a small jurisdiction. We've got a limited number of some of these services and they're concerned about the fallout from that. We work really hard with both the providers and the complainants to make sure that there's a positive relationship coming out of the complaint mechanism. Now that doesn't always work, I'll just be honest, because I can feel the comments coming on. But that certainly is part of the process, that it is about trying to resolve the issues, not about trying to set up an adversarial situation. And so for people who are concerned that in a small jurisdiction, next time they go to an ED or next time they go to a particular provider, that somehow or other complaint's going to be held against them, that certainly is in our experience. And I think, we see a lot of success in these matters of bringing complainants together with the providers so that the providers, be it a hospital or be it an individual practitioner, can actually understand the person's experience, not just what they see in the records or not just what their perspective is on what's occurred. And that voice is really important, and it's really valued by practitioners and providers in the ACT. So I really encourage people to pick up the phone first, have a talk to us. The first phone call doesn't have to be the only option. We certainly have people that might come back and ask us for a bit more information, ask for strategies around how to deal with things. Because part of our job is not just about the formal complaint mechanism, it's about providing people with information about their options. So really encourage people to pick up the phone.
Thanks, Karen. And so people can literally just pick up the phone, can't they? The Human Rights Commission does provide that service where consumers who might be thinking about it or need a bit of advice can just pick up the phone and have a chat to your staff, can't they?
Yeah, we take about 1,500 calls a year in a health space. So, and again, sometimes that's people just looking for their options, looking for, the language to use with a provider or with a service that they're concerned about. It's not always about bringing the complaint. People can pop in. It's Canberra. We're 20 minutes away from everybody pretty much. So they can certainly pop in and see us if they're more comfortable having that discussion, or give us a call to set up an appointment. We've got a very friendly online little form. People can just drop us an email, and again, where it's appropriate, one of our guys will give the person a call back and just have a confidential and gentle chat with them about what the options are, what the outcomes might be, what to expect from that process. So, we're the only health complaint commission that sits in a human rights commission in the country. So we're very cognizant of making sure that people's human rights are respected in the process as well. So I really encourage people to make contact. If we can't help with a matter for a particular reason, we have very strong referral pathways, as you know, and we will make sure that the person gets to the right place if we are not the right place for them.
Thank you.
Can I just add on to that, Karen, which I think is really important, and it kind of ties into that first question about why this is so important. And I think it was the, when, something's not right and, you want to provide that feedback, you often, go onto either social media or forums, and the information there is not accurate. And so, you were saying that, you can call in and things like that. Well, people mightn't know that. And so having these fact sheets, I think, it narrowed down that false information. I don't know how to word it properly, but I think it's that false information or that negative sort of, just people, getting together and having a bit of a whinge. So to me, it's really important, as you were saying, that people access that service that is going to provide them results rather than go around in circles. And someone did put up in the chat about accountability. And I think that that's really important with accountability, is you're going to accessing the services that are going to provide that support through the process. They're not just giving you this false information that, you can go to this place and have a cup of coffee and expectations or solutions are going to happen that are unrealistic. So, I think working together to have genuine information was really important in these fact sheets.
Getting the right advice.
Yeah.
Anthony, there's been some great suggestions there from Karen and Bianca. Have you got some advice for people who might be thinking about making a complaint?
Oh, look, absolutely. I can only add my support to echo what Bianca and Karen have said, in that the best thing to do is to pick up the phone and talk to someone, because managing and navigating healthcare complaints can be confusing when you exist outside of the system. People from my organization in AHPRA, we speak our own language and we understand our language and we're really fluent in it. But when you're thinking about making a notification, you might not understand the technicalities and the complexities in the same way we do. And so before you enter into that, it's a really good idea just to have a conversation. I think talking to advocacy and consumer groups is really helpful. As Karen said, Karen's remit is slightly different. We're really lucky in the ACT to have the health services sit within the Human Rights Commission, because it gives us that broader sort of umbrella view and gives us better access to the different types of support or resolution processes. And by having the conversations, it will help set set your understanding perhaps of the experience, and then help formulate what your expectations might be and what you're looking for as the outcome. Because one of the things that we know as an agency that we sort of struggle with really is when we receive notifications or complaints, but we're not actually able to resolve what the individual would like as the outcome. And a really clear and simple one is that we're not able to facilitate a refund, and we're not able to facilitate an apology. And if that's what you enter into our system looking for, it can be frustrating for you as the consumer. And it can be difficult for us because we have legislative processes that we have to follow. And so when we receive a notification, we have to see it through to the end. And so by being more upfront and having that dialogue and conversation at the beginning, we can sort of map out together what's the best way through, what's the most appropriate thing, and sort of just have that conversation. So only really to add to what Bianca and Karen said.
Thank you. And that's a really good lead into my next question, really, because I think it's very important to understand what to expect from beginning one of these processes. And that can be very different depending on whether you're taking it up with the health service itself or whether you've contacted AHPRA or the Human Rights Commission. So, you know, those examples you gave of, you know, whether you can get an apology, because sometimes that's exactly what people really need out of or perhaps they're interested in whether they can get some kind of financial compensation. Those things come up in conversations with us from consumers quite often. So, you know, is there anything else you'd like to say, Anthony, about what should people expect from a complaints process or a notification?
So I'll talk specifically a little bit about the notifications process, and then that will link in with Karen, because Karen and I's office kind of talk a little bit more than any other jurisdiction in Australia. So it is a slightly different relationship in the ACT, but a general notification process goes through a few stages. We receive the notification, we determine whether or not it relates to an individual that is practicing one of the 16 registered health professions. If it's not, then we have no jurisdiction. If it is, then that's a sort of a chain of events. We will do what we call an inquiry. So we just want to gather the facts and some information as best we can to help understand what's happened. One of the things that we know that when we receive a notification, irrespective of what the outcome might be, something has happened in a relationship with person and the practitioner that hasn't gone well. And so we kind of need to understand what's going on, what's the risk. That's our core assessment piece, is what is the risk? The risk to the public, is there an ongoing risk, and what can we do to reduce that risk? Sometimes in the course of the inquiry, when the practitioner is made aware of the notification, they will take corrective action, and that will reduce the risk of the incident happening again or anything ongoing. So that's sort of like the sort of things that happen in the background.
Could you give us an example, perhaps? Is there a simple example that comes to mind of something like that?
Sorry, so just an example of
someone raising an issue, and perhaps you know, the practitioner can do something about it.
Yep. So straightforward. One might be that you've gone to see, let's say you've gone to see your GP, and the conversation didn't go too well, and you left that room not really clear what the advice was. You're not really clear what you were told to do, and you didn't think the conversation was handled. You weren't listened to. The practitioner might recognize when we tell them that and we let them know that this is the subject of the notification, that there are some changes they can make to their communication style or how they go about the beginning of the consultation. And they can maybe demonstrate to us that they've taken some corrective action. So they might have changed their opening comments, or they might change how they conclude an interaction, and then demonstrate that that's how they've changed their practice. And so in that instance, we are unlikely to take regulatory action, i.e. imposing a condition on them or somehow restricting their practice, because in the process of us investigating and understanding the totality, they've demonstrated the corrective action. So that's just off the top of my head, most common or potential example. Karen, did you maybe want to pick up with some of the stuff that happens from your perspective?
Yeah, thanks, Anthony. I think one of the ways we think about it, I guess, is AHPRA and the boards are interested in the person's conduct, and so that's slightly different to what we're interested in, which basically is trying to resolve complaints as they come into us. So sometimes people will, I think, where there's been an adverse outcome, for example, go to AHPRA with an expectation that the board will take action against the practitioner. But unfortunately, particularly in the health space, you can have an adverse outcome without there actually being a conduct issue on the part of the practitioner. And that can be quite frustrating or concerning for people. And they're the sorts of matters where AHPRA or the boards might suggest to the complainant that they actually bring the matter to us, because it's that conversation between the complainant and the practitioner or the health provider where resolution might be found, even if there isn't a fix for the adverse outcome. And I think sometimes that there is, some confusion in that space, particularly where a person has had an adverse outcome and they're very committed to the idea that they want to protect the public from that happening again by having action taken against the practitioner. But the board is satisfied that it isn't, a conduct issue per se. And again, they might be the sorts of matters where the matter will come back to us, because our focus is much more looking at resolution of complaints. What are the things that would give that complainant reassurance that there is sufficient supports around that practitioner, and in fact it might have been a poor outcome, but it was circumstantial as opposed to it being a systemic conduct issue. I think that the other thing, as Anthony has indicated, is that where people are looking for compensation or apologies or other sorts of systemic outcomes from a health service, that they're the sorts of matters that will tend to end up in our space. Again, because I've got a very broad remit looking at the conciliation function, which AHPRA doesn't have. And so it sits more in our space to try and get people both a response, but also to sit people down and see if there is a way to work through those issues. And again, if people are looking for some sort of systemic outcome or looking for some assurance or some process that the events won't reoccur, then they're very much matters that we would be able to take to a conciliation conference with the provider. So that they are slightly different processes. Certainly, if people call us and it is a matter that sits more within the AHPRA space, we're in a very fortunate position, as Anthony indicated, that we've got a close working relationship with AHPRA. We're able to bring that into our process and handle the referral across to AHPRA ourselves, rather than bouncing people around the system, because we get the more phone calls people have to make to get into the system, the more likely they are not to follow it through. And so that's part of the process that we've negotiated in the ACT, is that it is no wrong door approach, which I think is a real strength of the system here.
Thank you, Karen. Can you talk a little bit more about what that conciliation process is? When might that happen, and what would it look like? What kind of thing might become a conciliation process?
Yeah, so Kate, it very much will depend on the circumstances. There are some matters where we've got someone sitting in the hospital or sitting, for example, in a palliative care setting. There's restrictions on the number of visitors that the person can see. We will get on the phone and try and sort that out. And that's very much a facilitated discussion between us, the complainant, and the provider about trying to get to resolution, because it's time dependent. There are other matters, as you know, which might be more complex. For example, concerns about the birth of a baby or concerns about the mental health system, where that really quick response isn't what the person is looking for, and it doesn't necessarily meet their need in terms of wanting to get some information, being able to think about it, and then being able to sit down with the other party and have a discussion with them about their concerns and also what sort of outcome they're looking for. Outcomes vary depending on the nature of the matter. I mean, some of our complaints in the dental space, for example, might be a reimbursement if there's been a poor dental outcome and someone needs to go off and get some reparative work done. That's quite different to, for example, a matter in the mental health space where it may be that there's been concerns that have emerged over an extended period of time. And what we
Does anyone else have Karen frozen?
Oh, I have Karen frozen.
Really need is a discussion that meets opportunity to get the information together to the table and have that discussion with that person, because it's one of the key things that we look at where there is an ongoing relationship, that those relationships are preserved, and that is a big focus for us. I know for some people, I can again hear the feedback coming, but that can be really difficult when, you know, often when you're engaging with when someone's engaging with some of these health services, they don't feel that they have the agency or autonomy. And so sometimes bringing the complaint is trying to re-establish those relationships or re-establish some agency in that relationship, and that's really important. So I think anyone who's both brought a health complaint or access to health service can understand that complaint mechanisms aren't always the best way of dealing with these things, but the fact is they do provide a vehicle for a third party, that's us, to bring those parties together and try and have that facilitated discussion and try and reset the relationship a bit.
Yeah, and sometimes you need that facilitated discussion. Usually, I think, you know, people would probably attempt to resolve it themselves if they could with the health service in the first instance. And sometimes that can be quite a straightforward and simple thing, but I guess for a consumer, it's having the courage to do that, especially when you might be concerned about it having an adverse effect on your care or on your future care. You might feel a bit like that's a bit of a difficult thing to do, because, you know, we do rely on that care. And I just also wanted to sort of flag one of the other things you said there, Karen, about, you know, what the outcomes might be. I think for consumers it can be really helpful in thinking about whether you want to do this, to think about what is it you want from the outcome in the end. You know, sometimes it's an acknowledgement that things didn't go well or things weren't done correctly. You know, sometimes it could be some kind of a validation of what you've been through, but at other times it might be that you do actually want to see some system change for future consumers. It's not really about you anymore. And there are other things you may want from the process too, but I think it can be helpful just in thinking about it in your own mind and what you want to do and how you might want to do it
I think that's
those goals.
And I think that's really important what Anthony and Karen were saying. It's that map it out, but realistically. Like, you know, I think in the chat there was a lot about carers, and, you know, and I've got the consumer hat on today, but I will just say with the carers, I think it's really important that if you are going to go down, or as a consumer as well, it's going to take time. It's not going to happen overnight. You know, you raise that issue, you raise that concern, you know, give the, as what does Anthony say, the notification, and that it might be, you know, by law, I think, I can't remember exactly, you know, complaints have to be held, you know, within so many hours and things like that, within the commission and things, depending on like the triage or whatever. But, you know, the initial outlay might be within that time frame, but the process does take time. And I think, you know, if we, you know, call these organisations, they need to explain that and say that, you know, yes, it might take 6 months to, you know, come to that resolution. It might, you know, take, you know, longer than that, depending on that situation. But I think we need to all be really aware that, you know, if you are going down the process of using the fact sheets to get that information, to put forward, you know, your concerns and issues, it does take time to resolve them.
And that is one of the expectations, that it's good to kind of have a realistic idea of what that time frame can be. And whether you're talking to, you know, AHPRA or the Human Rights Commission or the Health Service itself, every one of them will have a time frame that they aim to resolve or to progress these things in. So it's always worth asking, you know, what that time frame is, like what you can expect as a consumer, so that you don't develop that kind of frustration unnecessarily, if it is going to take a while. And depending on the complexity, it might. So,
And just with that, because I think another thing is, you know, you hear a lot of negativity sometimes of, you know, making a complaint, you know, on that it's going to red flag you that, you know, you're a pestering consumer, or, you know, annoying consumer or something like that. And so I think you've got to think about, you know, like I think, you know, Kate, you've mentioned it. We all sort of mentioned it. It's that knowing exactly what you're complaining about. Is it against the professional individual? Is it the system? Is it, you know, your care? Is it the hospital system? Yeah, you've got to really narrow it down to know who that right person is, and you know, use this information from HCCA to address that. You know, so
yeah, sometimes that can be quite hard to
and
work out.
It
or
is
it's a combination of factors,
yeah,
as well.
Yeah. Which is why I think these, you know, sheets that, you know, HCCA's put together is really good.
HCCA with the help of almost everyone else in a related field in Canberra. Yes, thank you, everyone. Okay, so here's a little bit of a chewy one. So I'm going to send back to Karen and Anthony. Is there, this is from the chat, a summary, how are feedback and complaints information collated across the ACT, or are they, to guide systemic improvement across different providers or agencies? Who'd like to have a crack at that one?
Yeah, so there's certainly from our perspective, there's different mechanisms by which we do that. So for example, we might get a number of complaints that raise a similar sort of issue. And then, as I said before, what we might do is initiate a known motion complaint, a known motion investigation, so that at the end of that process, we've got a better perspective about whether those matters are exceptions or whether there are systemic issues that have been identified. Coming out of that, we can make recommendations to the health providers. In the case of ACT Government or CHS, they will often go into a process looking at budget and resources and things like that, or it might be a change in policy, it might be a reflection on education and training. So the annual report, which is, you know, good if you've got sleep issues, is a way for us to put all that data in one place, but that's not the main vehicle that we use to provide that feedback. So right. For example, we will identify systemic issues coming out of a range of complaints. We may go and meet with the providers, or as I said, what we might do is do a report, come up with some recommendations, and that might lead to resource changes, policy changes. A recent example, we did some work in the palliative care space, and provided a report to government to look at some changes in how those services were being provided, the public information available about those services. So there's a range of ways that, depending on whether it's a private provider or a public health service, we might provide that information both to the public but also back to the providers.
Right. So an own motion investigation is where the Human Rights Commission identifies what they think might be a widespread or systemic problem that needs a bit of further investigation. Is that right?
Yeah, so it can be, so for example, I think it's on the public record that a few months ago we started an own motion investigation with respect to some of the issues that have been brought to our attention regarding DULWA. We've done a range of consultations in that space, both with carers and consumers and with staff. As you know, there's been a more recent announcement by the government that there's an inquiry going on in that space. We will be using some of the information that we've particularly got from consumers to inform a submission in that space. And so even though we'll still come out with our own report, that information we hope will go to informing the inquiry that government has announced. So there's a range of ways, I guess, that we use those powers. There's some other, you know, so for example, we will get anonymous or confidential notifications from practitioners who identify particular concerns in a particular practice or in a particular service. And that might inform our approach again about initiating our own investigation into those issues, obtaining some information, often being on site or going and interviewing people, and then making some recommendations coming out of that. So for example, we did a couple last year in the aged care space, where we've got some of that information, got some of that consumer feedback, gone back to the aged care provider and made some very specific recommendations to improve the service. And then a couple of months later, we'll go back and meet with them to make sure that those have been implemented. Wow. So there's a range of ways that we work, and a range of sources of information as well. So if people do have concerns about particular practices or health services, we can also take confidential or anonymous notifications in that space.
So that was going to be my next question, because you did just mention practitioners can raise an anonymous concern, and consumers can do that too.
Yes.
Yes.
But sometimes, it's very, very difficult for an individual practitioner, for example, to respond to a complaint about what's happened with an individual if we can't identify the individual, and that raises some different concerns. But if in that more systemic space where people are concerned about a particular practice that's happening in a particular setting, then that is something that people can call us about. There are circumstances where we will, again, initiate an own motion, get a response in that space, and then work out whether we need to make recommendations or whether there's some other vehicle. So for example, we might take it to an accrediting body to then get them to go and have a look at the situation, or take it to the Health Protection Service. So for example, where people raise with us concerns around, sterilisation procedures of equipment or concerns about infection control, we might do some initial information gathering and then go to HPS and say, we actually think that you're probably better placed to deal with this matter. So there's a range of ways that we try and use information to make sure that we're improving outcomes across the ACT.
Thank you. Anthony, can people make an anonymous complaint to AHPRA?
You can make an anonymous complaint. I think what I would say there, though, is that it does limit the capacity of the regulator to take action, because one of the things we do, even if we have an anonymous complaint, we would want to be able to put the scenario or the experience to the practitioner and allow them the opportunity to respond. And so if we have a complainant where we're not able to do that because we've been asked to maintain anonymity, it's a challenge, because we have no capacity to say to the practitioner, this was the day, this was the time, this was the incident, this is the person.
Yes. So it does limit what can be done.
Yeah, and that goes back to some of the comments we've made before about this perception sometimes perhaps that consumers and patients have, that if they do give the name, then it makes future healthcare access, it makes it difficult. So we kind of have to have those conversations about the balance and about the circumstance and about what do we do to support. And really going back to, I think it was one of Bianca's opening comments was about validating your perspective and having that conversation, but then saying, but here's how we manage the expectations and limitations and what we do, and are we the right agency or is there another agency? Yeah. Which again, I think just to give people reassurance, whilst we would not say it is perfect, the opportunity in the ACT is quite different. Because we do have different relationships and we do talk and we are smaller. And so we're able, whilst we're obviously working within all of our legislative requirements, we do get, if something comes through to AHPRA, we do have to talk to Karen's office about it. And that might not happen in other jurisdictions.
Yeah, it is quite different here.
Yeah.
Yeah. And I think, that is an ever-present concern, I think, for consumers about, being driven to perhaps want to make an anonymous complaint or concern because they're concerned about the impact it might have on their future healthcare or their relationships with providers. And certainly, I think that can be more present when you involve an external agency, potentially. And sometimes, we always do here at Healthcare Consumers, we always do encourage people to when things in the moment or close to the time when things have not gone well, to try and resolve that if they feel confident or able to do that, and have some support to try and resolve it if they can, with the team providing the care, if at all possible, because I think that is actually one of the ways that you can preserve those relationships into the future with healthcare providers. I know we're coming to the end of our time today, and we have got some great questions popping up in the chat, which I think we're not going to get to, but we will take them out of the chat and send some answers around. I'm just going to ask one more little quick one. It might not be a quick one, I hope it is, to both of you. And I think you've both touched on this, but I'll just ask you one more time. Who is responsible when your organisations make recommendations? Who's responsible for implementing, monitoring and reviewing those recommendations once they've happened?
I'm happy to say, so if we've made a recommendation that relates to an individual practitioner, you'll see that on the public register. So if we've taken action and proposed conditions, or it's been an extreme event and we've maybe moved to suspend or remove registration, the public register will show you that. And then if it comes to monitoring compliance with conditions or restrictions, then AHPRA will do that. We have entire teams that provide that monitoring and compliance with the terms of conditions that you see on the register. But that might be different when you move into Karen's space and those other broader recommendations. So I'll use that to hand over to Karen.
Thank you, Anthony. And I'll just say we'll send a link to that register around with our post-seminar email so people can see what you mean when you talk about the public register. Karen, in terms of the Human Rights Commission, who is responsible for that implementation, monitoring, recommendations kind of function?
Yes, so when we make recommendations to a health service provider, we put a time frame on them responding to that to tell us if it's practicable and what time frame they can do it in. And then we have a follow-up mechanism within our internal systems. Generally, if it's something that they've got a 6-month or 12-month time frame to do, we have a follow-up mechanism to go back and touch base with them on that. We also know that government, for example, where it's been a report of some substance, will come back to us every 6 months or so to tell us what the update on that was. So it sort of depends on the nature of the matter, but it's both a responsibility on our part, but also a responsibility on the provider's part. That's in the legislation.
Right. Thank you very much. Now, sadly, I'd love to keep chatting about this. There's so much we could talk about, but we're at the end of our time today. So I would like to just draw your attention to the feedback link in the chat right now. Please take a moment to fill out a few questions that will help us to make sure that our webinars of the future are targeted to what our audience needs. We'd be very grateful for your feedback. Also, I think in the chat are about to go the links to the guides one more time. And please chat to us at HCCA if you'd like to discuss any of the content today. And finally, I think I would like to thank very much our fabulous panel members, Anthony, Bianca and Karen, for being willing to spend this time with us and help us learn more about complaints and what's involved. We will, as I said, send the questions that we've received with some guidance around participants today. We'll send the links to the guides. We'll send the public register that Anthony was talking around as well. So thank you. Thank you, panellists. Thank you, audience members. And people chatting in the chat. It's been very lovely to have you all and very informative too. And we'll see you next time. Bye, everyone.